Bridget, thank you. It was 5 years ago yesterday that the World Health Organization declared COVID-19 a pandemic, meaning it had touched the entire world. It was only 2.5 months after we first discovered it existed. That's how quickly it swept the world and caused death and destruction. It's been 5 years since then as we bring in Dr. Syed Hussain from Trinity Health of New England to talk about that. Good to see you again, Doctor.
Likewise, Tim.
Listen, we've talked over and over about the death, the destruction, the social isolation, the school problems. But you were mentioning a couple minutes ago, it did force innovation in some ways, especially in the healthcare field.
It did, Tim. So we've lived through a very historic time, right? And it's been 5 years.
Yeah.
But I almost see it like a tale of two cities.
Right.
So I say that because there was a degree of confusion and division that divided society. The virus did, but then there was also remarkable collaboration, and we had vaccines that were developed in record time, a new platform for development of vaccines that could be deployed in the future when there is a pandemic. It's when, not if. And also, the remarkable collaboration we saw in Connecticut between the governor's office, the Department of Public Health, and healthcare organizations across the state is a model that can be replicated in the future that we've learned from.
Yes.
But there was also a lot of division. So what I want by that, I mean follow the science. There was a lot of misinformation that we had to battle when it comes to vaccines.
Still is.
Even with the virus itself. So those are all lessons learned that we need to learn from moving forward.
Now, getting to the death of Gene Hackman and his wife, a lot of people were worried about how he died, but his wife, Betsy Arakawa, died from complications from a hantavirus infection. I'm guessing a lot of people don't know about it. What do they need to know?
Yeah, this is mostly from rodent transmission, Tim, either rodent urine or feces. When an individual exposed can develop these symptoms, there's no person-to-person transmission, important point. It's mostly in southwest of this country that you see this virus, and initially it can cause flu-like symptoms. So you may have fever, body aches, fatigue, which then about a week to 8 weeks after exposure to rodents or rodents' feces, urine, and then some people can develop pulmonary symptoms.
Yes.
And that could be shortness of breath, chest tightness, cough. And a third of people who develop lung symptoms can actually die.
Yeah.
There is no cure for this. It's supportive management, but diagnosing it early on is really, really important.
Yes, and we need to say that again. Yes, a third of people with pulmonary symptoms can pass away, but it's not person-to-person spread.
That's correct, yes.
Which is a very, very important consideration. And there's also a whole family of hantaviruses as well, too, that can cause other syndromes, other diseases, too.
That's right.
But yeah, probably not a huge concern.
But folks may, because they might think, okay, this is flu season, it resembles the flu, they may not seek medical attention early on.
Yeah, so please do that. One more topic we want to get to, microplastics. A study found they could be fueling antibiotic resistance. I don't understand what one could have to do with the other.
Yeah, so the analogy I'd like to present is, microplastics are almost like a raft. So bacteria can't really swim upstream in a river, for instance, but they can cling onto microplastic. They develop a biofilm, which protects them. And those were studied in this study that was recently published. And there was a remarkable degree of antimicrobial resistance.
Wow.
Which is resistance against commonly used antibiotics, which is concerning because microplastics are everywhere.
Yes. Is this one of many studies that have found that? Is this the first of its kind that we know? I always have to ask, how much do you want to put into the results of one study?
Additional research is needed. Good point. It's probably the first, but we know, the problem of microplastics in general, but more research needs to be done.
And that is very interesting, that sort of the idea of how they think one could lead to the other. That sort of life raft analogy. I hadn't heard that before. So thank you. That's why we got the doctor on, Dr. Syed Hussain from Trinity Health of New England. He joins us every week to talk about these trending topics in health. Glad we can cover 3 of them with you. Thank you, Doctor.
Tim.
See you again next week.